always messy. Because
When the grown folks is talking.
so that's what we doing?
Welcome back to Messy Medicine. We are 4 board-certified physicians here to combat fake news by providing you with evidence-based knowledge and medicine. To my left, Dr. Chris Ibikunle. To my immediate right, Dr. Jocelyn Slaughter. And to my far right, my boy, Dr. Nicholas Jones. And I am Dr. Marc Jean-Gilles. Today we're going to talk about bad outcomes and complications. Today we're just going to discuss some clinical cases that have been in the news or on social media. So what we're going to do is be speculative, but with our knowledge, we're going to try and see what could have happened. How did this get to this point? And we're going to just use our knowledge to try and figure it out.
And see what's fake and what's actually real.
Right.
Because there's been a lot of fake stuff going around and a lot of rumors that are not true. And we are here to figure out and help you find out what actually is true and what's not.
First case we're going to discuss, recently, the Princess of Wales,
Yes.
Kate Middleton, said that she was diagnosed with cancer. There was a conspiracy theory. Nick, there's people still on the internet saying that this is a cover-up for a plastic surgery gone wrong. So I just want everybody to chime in. Do you think that's real or fake? Is that conspiracy real or fake given what she has said? So what do you think?
I think the coverage of the news was messy. So I'm going to say messy for coverage. However, as far as the outcome and the news that we now have, I think it's real.
I would say that media is messy, so I will agree with, the messiness of media coverage on it, but this idea that it's a plastic surgery gone wrong, I mean, come on, that's kind of being cruel, so I'm gonna say it's fake. That part is fake.
This was messy as hell because they had us thinking that this woman had plastic surgery, that she had a mommy makeover. They had us looking at these Photoshop pictures that she Photoshopped herself and her kids on the pictures, and they had detectives, and it was just wrong.
Nick, it could a mommy makeover, for those who still want to run with that idea, would that entail a hospitalization for like 2 weeks?
Absolutely. I mean, I think any sort of complication. I mean, if you undergo any surgery, there's always a possibility of a complication. Now, to be in a hospital for 2 weeks after a plastic surgery is highly unlikely, but it is possible. I mean, it just really depends on the severity.
Right.
But based on the information that we have, obviously the media is always messy because
messy. There you go.
she's a
Messy
I mean
as hell.
she's a prominent figure, and so when these celebrities or these dignitaries they end up in the hospital, people want to know what's going on. So I mean, she may actually have something much more serious,
Right.
But anything that causes you to be in the hospital for 2 weeks, I would consider that something very major.
Here's what we know. January 17th or so, she had a surgery in the hospital. And initially, it was for a tumor of some sort. We don't know where. It could be ovary, it could be bowel, it could be pancreas, who knows where. And then initially, it was thought to be benign. Then after what she deemed post-operative test, it was deemed to be cancerous. And by post-operative test, that just means the pathologist sliced it up, looked under a microscope, and then found cancer, right? Then it sounds like she had to get more surgery, and that entailed a 2-week stay, 2 to 3 week stay, and then she was out of the public spotlight for a while. And then all this silliness went on, Photoshop editing or whatever, and conspiracy theories. And then she comes out, gives the news of cancer, and says she's having preventative chemotherapy.
My thought would be she went in for an ovarian cyst. They removed the ovarian cyst. They let her go home. They didn't do a frozen section, which is when we can actually test it right then. Or maybe they did and they didn't find anything. Everything looked normal. She went home, and then when they got the permanent back, the pathologist saw that it was either cancer or low malignant potential or something where they were not sure. Then she had to go back in to do an actual staging like omentum, or that's like the fat pad under in the peritoneum, pelvic washings. They went back and did more aggressive staging or to get some more samples, and that was the additional surgery she probably had. That surgery, there could have been some issues. Maybe it was an open surgery. It might have been laparoscopic. I'm not sure. You could let me know how well they can do that laparoscopically, how well they can do that part. Like if they can do some omental sampling and lymph node dissection laparoscopically. And then when they got that back, they probably had to send it to a whole bunch of pathologists and oncologists. Do you think she needs chemo? Do you not? So they were just waiting for the information for the call. It's sometimes very difficult to determine if somebody truly needs to have chemotherapy, if you really want to call it a malignancy, because these things under the microscope can be so like, ooh, I don't know. So I think they were really just trying to wait to know. The actual royal family maybe did not know as a patient, is this actually something that's malignant that you actually need chemotherapy for, or did we get everything just with the excision?
Basically, there are tumors that essentially, they're not quite cancer, but they're close to it. They don't meet the criteria, but they're close to it. And so there are low malignant potential tumors. It's borderline. These types of tumors necessarily don't require chemotherapy. However, I understand that she's the Princess of Wales, and if I had a patient with a low malignant potential tumor, a borderline tumor that's not quite cancer, I would still go all out and make sure that it's not. So that would entail a bigger surgery where the incision goes above the umbilicus, above your belly button, all the way down.
Right.
And like Jocelyn was saying, there's staging. You remove some fat over the bowels, and then you have to do some dissections around the aorta and pelvic lymph node dissections as well, in addition to removing the uterus and the other ovaries as well. Chris, being a trauma surgeon, we discussed the gynecologic potentials, right? I also think another possibility is maybe it was a fibroid, they took it out, and it turned out to be a cancerous fibroid, a leiomyosarcoma, and that diagnosis is very grim. It's very aggressive.
I hope that's not what it is.
I hope that's not the case, but I would think that they would do a frozen section and find it right then and there.
But also keep in mind, she is the princess, so
Yes, everything's going to be extra.
They may have just said, "Hey, we just gonna keep you in the hospital the whole
That's
time."
true.
It could be that simple too. It could be a simple thing of like you're not comfortable, you're not moving your bowels, you're not sure.
Alias.
We're just gonna keep you here until until you're comfortable. For those of our audience who have difficulties understanding what Professor Marc is saying, I'm Googling all those big words, and I'll explain it to you later about what malignant potential means. My take on this is, I think as a young woman, relatively young lady, 42 years old, a mother of 3 young kids, I can understand why she may not want to share the news with the public, unlike someone like Nick, who's out there. You're out there, you are all in everybody's faces. And some of us simply are private. The way you handle your health news might be a little bit different than how Princess Kate will do it. So I understand it, and I truly feel for the way she announced the diagnosis. It takes a lot of courage for a young woman to do that and to really explain her thinking about how she handled the public on this. How it was important for her to explain to her kids what's going on first before she comes out to the world. So I respect that, and I feel for her, and I support her, and I pray for her health. There's so many things that could have gone wrong. It could have been a simple, we found a cyst in your ovary on ultrasound, and we're just gonna take it out with small incisions. And then, like Jocelyn mentioned, hey, we got in there, it looks weird. So we have to make a big incision. So you go into the hospital for an outpatient, same-day surgery, and you end up with a big incision, and it takes weeks to happen.
Even if you are the Princess of Wales, and I'm sure she has the best doctors over there taking care of her, even with that, we still can get caught off guard or be surprised when we actually go in and operate. So we wish her a speedy recovery. We pray for her and her family and hope that This is a cancer that will go away and stay in remission forever. So we're praying for her. Next case. This one involves a young lady. Now, she was on social media. She said that she went to the doctors, that she was bleeding, and she was sent home. And she was told she had fibroids because fibroids can make women bleed vaginally. So she came back again, was bleeding some more, passed out, and then finally somebody decided to take a look inside her vagina, and turns out that she was diagnosed with stage 3 cervical cancer. Does this sound real or fake to you, Nick?
Oh, that sounds real to me. Very real. And the reason being, I feel like a lot of women, especially minorities or women who don't have access to health care, they probably don't get routine studies done. And then not only that, I also feel that a lot of physicians sometimes they overlook a subset of patients, or they may not get the same type of care.
In America, this should be a fake story. Nobody should be dying of cervical cancer here. When most health departments screen for cervical cancer for free, there should be nobody dying from cervical cancer. It should be fake. But unfortunately, it's real that people are actually still dying from cervical cancer, which is something that can be screened and treated for and prevented with the simple procedures of LEAP procedures that we can talk about, which is the treatment and prevention of cervical cancer. And we even have a vaccine that you can get to prevent you from having cervical cancer. So it should be fake, and it is so sad that this is a real story that's happening in 2024.
I have to agree with Jocelyn on this. It should be fake in the United States, but it's unfortunately real that women of color, patients, minority backgrounds, their symptoms and their complaints are always getting downplayed, and patients end up with just bad outcomes from doctors not really taking time to understand their problem.
Was she black?
She was black. She is black.
She is black.
Yes.
Is she still alive?
She's still alive. With that said, and the story is real, by the way, but number 2, how did this take place, right? So that's what we want to understand. Like, how did we get to stage 3 cervical cancer being misdiagnosed for fibroids?
I love that question. I love that question. You know why, Nick? Mark? Because on one hand, when it comes to disparity, which is basically people not getting equal treatment, we need to look at what doctors and what our healthcare establishments are doing wrong, or what we can improve on. We also have to talk about collective responsibility on what our patients, our communities can do to improve health. I love Jocelyn's take on vaccination to prevent cervical cancer, screening to identify those conditions earlier. So I'm not a specialist in cervical cancer, so I really want to lean on your knowledge base here on this.
You don't get to stage 3 cervical cancer overnight. I mean, cervical cancer is slow growing. To get to stage...
Is this the person you're talking about?
Yes.
She passed away.
Oh my gosh.
She passed away.
Yeah, I think that's why it was such.
That's why it's a big story, because she actually passed away. This is a black woman with stage 3 cervical cancer that was misdiagnosed, and she actually died.
Right.
So it's even worse. And when you say, how do you miss something that is easily treated and preventable? Why didn't she get a pap smear, a true pap smear? Which is the Papa Nicolau? Why didn't she get examined vaginally? Well, most of us who are OB-GYNs, we actually unfortunately know how this can happen.
Right.
Many a times, unfortunately, people, and not just patients, even other physicians can get confused between what a pap smear is and what a pelvic exam is. And so a pap smear is actually short for Papa Nicolau, which is a cervical screening test that tests the cytology of your cervix. Some people say if anybody puts a finger, looks in your vagina, that's a pap smear. It's not. It's actually a test that they take to the lab. And it can feel the same. If you open your legs and somebody does something down there, you think you had a pap smear, and then you can't see what they're doing. And so women oftentimes, if asked, did you have a pap smear this year? Yeah, so somebody was down there doing something, and nobody questions them. Was it normal? Yeah, they didn't say I had anything. So if you're a historian, you're the patient, you think you had a pap smear.
So Justin, what you're saying is the examination with the scraping of the
The
cells.
cervical
Yeah, it's the
yeah.
scraping
How often
and
are women supposed to be doing that?
So we'll talk about that. The recommendations are you could do it every 3 years without co-testing. Co-testing is when you check for the HPV virus. The reason why we check for HPV virus is because 99% of all cervical cancers are associated with some form
Are
of
you
HPV.
telling me that virus causes cervical cancer?
It's an association. It's a trigger.
That is
So,
amazing. That is good news, which means we can literally treat this virus. And
well,
prevent
it's not
With the
so.
vaccine.
The vaccine will prevent it. There's no treatment for it. Most of the time, in most of these cases, when we get an abnormal pap smear that is positive with HPV, we can follow it, see if it resolves on its own based on the person's immune system. And if not,
We can do
Jocelyn
it.
was saying we can remove the abnormal cells via surgery. But back to the recommendation, every 3 years, if you're not doing the HPV testing, every 5 years, if you are negative for HPV and your cells are normal, you can go to every 5 years.
So Mark, let's give it a little bit more clarification. If I have a daughter, when should she get her first pap smear?
The recommendation, 21 years old.
21 years old.
What
But
if she's sexually active
21 years old.
at the age of 15?
so let's make sure we're understanding though. She should get a pelvic exam. We can actually examine women and look at their vagina and look at their cervix. You can actually get a physical exam of your vagina and pelvis at 18. Okay. Now, but we do want to actually do a cervical exam and actually test for cytology at 21. So that's a lot of times people confuse this. So the PAP versus the actual looking at the vagina. Looking at the vagina, looking at the cervix, testing for infections, testing for sexually transmitted infections is two different things.
I want to
Still, recommendations though, start pap smears at 21 years old.
For cervical
answer
cancer
this question
screening.
about, if I have a
Yeah.
young daughter who is sexually active, that's where the HPV vaccination comes in. So they
gr-
recommend HPV vaccination as a way of preventing
Right.
virus infection that is strongly associated with
Right.
cervical
And,
cancer.
and again, just understand that there are hundreds upon hundreds of types of HPV, and there are hundreds that are associated with cancer. Now, in the United States and worldwide, HPV types 16 and 18 account for 70% of cervical cancers, right? So, with that said, the vaccine is only targeting two of the high-risk HPV virus, right? So, it's not an end-all, be-all.
You still
need your
need
screening.
your screening. You need a pap smear and you need somebody to be looking in your vagina.
But we're-
Jocelyn and Mark,
Yes.
here's the deal. If a woman comes to the, and I'm not trying to be callous here, I'm just trying to play devil's
Yes.
advocate.
Yes.
If a lady comes to the ED with vaginal bleeding and they have stage 3 cervical cancer,
Yes.
number one question is, what is their chances of healing successful? And two, do you really want to blame the ED for that delayed presentation?
So the harsh reality is this, and this I'm very sensitive to the disparities, but not everything is just blamed on systemic racism or whatever have you. Whatever, it's not those ED docs' fault, right? I understand the ED, they're inundated with a bunch of patients. They see a lot of vaginal bleeding, and yes, they may have overlooked it. But the cervical cancer was there for years.
Yes,
If it's
it's a
stage 3, it's
slow
been there
growing.
for years. Something just reached a point where it started bleeding a lot. And cancers can bleed.
And this is the importance of what we do, is having a, as you go to your doctors and your specialists, having a a physician that's your primary doctor, your primary care, your obstetrician, gynecologist you see every year that you maintain a relationship with, that you're comfortable with. Sometimes women they don't get comfortable, they see another doctor, they go to the ER, they go to this specialist, and they're not having that relationship. And so with our, even our individual practice, we see women years after years, we know them, and we can say, hey, you haven't had a pap smear in a couple years, or we want to have these relationships with these women so that they don't get lost in the system. And so we do encourage anybody that's watching, have a relationship with your OB-GYN, your primary care, so that and be comfortable with them. If you don't trust them, find another one, so that you can be comfortable, because your preventative visit is not the emergency room. It's not the specialist.
Right.
We're the ones that are going to help you live a long, healthy life, because we're helping you with your preventative care.
So definitely there's a lot of fake news about
Yes.
vaccination. However, cervical cancer is a real problem.
And it's still
I'm a father
affecting-
of a
Oof.
21-year-old daughter and an 8-year-old daughter. I'm having a conversation with them about both pap smear and HPV vaccination, and I would strongly recommend that all ladies out there, please get with we have 2 amazing OB-GYN doctors here.
Please.
Give them a call, educate yourself about this problem, and please get yourself checked before something bad happens.
Yes, I think that when we look at what could have happened, the worst case scenario is, let's say she did go to a doctor routinely and there was a abnormal pap smear and it was just ignored year after year after year, then that is just malpractice, right?
Right.
That's highly unlikely.
Highly unlikely.
unlikely.
Highly unlikely.
I find that highly, but it's
Also, cervical, I'm a GYN. If a patient's coming to me for her annual exam and pap smear, I've diagnosed
Right.
cervical cancer once I got in the vagina, and I'm like, oh my God,
Or
what do I have here?
What could have happened? What I would suspect, like most people, I would say a lot of people don't have insurance, so they don't want to go to the doctor. They end up going to the doctor when they have a problem. Where do
Yes.
they go? Urgent care, emergency room.
Right.
What is the purpose of urgent care, emergency room? They just to stabilize.
Make sure you're not dying.
Stabilize.
they don't do pap smears.
Right.
now.
Stabilize it. Here, you need to follow up with your doctor. And then maybe it stops, and then they go back to the ER. And the same thing keeps happening over and over again. The other thing is, some people don't have access to health care. Like, we say, go get these preventative screening tests, but, how many of you know someone who doesn't have a primary care doctor?
I would also speak to a real truth, which is we have patients that have insurance, and whether they're pregnant or not, and they just will not come in for their visits. So what we'll say is this: was the ED docs? We're assuming this was in the emergency department. Okay, they're not to blame for the cervical cancer. It was there for years. It just presented itself that way, and the reality is it wouldn't change the outcome, unfortunately. Now, with that said, for all the ladies out there, take care of your health. Make sure you go see your doctors. Make sure you advocate for yourselves, and just be seen. Be seen. Get your annual exams. What Jocelyn said is important. It's all about preventative care. Once it reaches stage 3 cancer, pretty much virtually all cancer, if they're stage 3, there's not much we can do about it. So
Right.
again,
It still is possible to have a cure rate, and at that point, cervical cancer is treated non-surgically.
It's chemoradiation.
It's chemoradiation, and there are things to do. Unfortunately, with her, she did not survive, and it appeared to be healthy. But I know we do got to get to one more topic at least.
well, okay, so again, let's just, encourage preventative care so we don't have these tragic outcomes.
Yes.
Okay.
Yes.
Next case, Nick.
Nick is
this
in the hot
is
seat.
this is more your specialty. Comedian DC Youngfly from Wild and Out, his partner or wife, Jackie O. The story is she underwent a BBL, right?
A BBL.
BBL, Brazilian
butt,
butt, right?
Yeah.
Yeah. Gluteal augmentation. Apparently, after surgery, she developed a headache, became unresponsive, and then eventually was found to be dead. And they noted bleeding around the torso. What this sounds like to me is she developed some bad infection that went to her brain, and so much swelling occurred that the brain herniated. That's what it sounds like, and then she just passed away. But how do you get to this point from a BBL? What could go wrong? And please educate our audience about the potential pitfalls of this procedure.
First, we got to survey the non plastic surgeons on, because the storyline that was out there was that the surgeon did basically a botched surgery, and that so this was just some botched horrible surgery. So
Was he a plastic surgeon?
that this was just a
He was a
horrible
plastic surgeon.
horrible surgery. So I think the question that we can pose to us non-plastics is that fake or real? Do we think that this was a just botched plastic surgery? From what you heard, that somebody went into surgery, they complained of headache. I guess they went home, and then, as they say, they died at home or died at the hospital. A young person.
I would say that being botched, that part, I'm going to say it's fake. And here's why. Surgery is surgery. And anytime you sign that informed consent, first thing, when I get my patients to sign it, risk of infection, bleeding, damage to other organs, and at the bottom, death, right? It's an inherent risk. Surgery has risks. So whether you are getting a hysterectomy, a BBL, bariatric surgery, breast augmentation, sure, the overall probability of survival and everything turning out good is very high, but there's still a legitimate, very real risk that it can go very bad. So I think this may have just been an infection that just went
What do you
wrong
think,
very
Chris?
quickly.
Well, I think it could be fake and it could be real.
You got to pick
And for
one.
that
No
reason,
capitulating.
I'm going to pick one. I'm going to say it's messy.
Okay.
Okay.
Because we don't have the details
information,
of what
right.
happened.
Okay, we're
Well,
just
we do
speculating
know,
here.
and
Yeah.
Professor Nick is going to tell us about what are the risks of BBL, and fat embolism is one of them. So just educate us.
First, let's just talk about Marc's speculation.
Yes.
Highly unlikely to die from an infection a day after surgery. Like it takes time to develop an infection. I don't care what type of surgery you have, unless they're using instruments that are completely contaminated, full of feces or something. No one would. I wouldn't think that someone died from an infection the day after surgery. Now, with a BBL, there are some complications that are more inherent to the procedure, and mortality specifically, fat embolism. So basically what happens is when you're transferring the fat into the buttocks, all of the blood vessels are underneath or below the muscle, the gluteal muscles. So if you rupture or injure one of those vessels, specifically the gluteal veins, fat can go into the vein, go into your vena cava, end up in your lungs, and is fatal. And so if that was the case, I would have suspected that to happen intraoperatively. But the fact that she went not home, but I'm assuming it was
She was
overnight
recovery house.
a recovery house or
Okay.
something of the sort, and she died there, it was probably something else, maybe like a pulmonary embolism, which is also similar to fat embolism, but basically there's a blood clot typically in one of your large veins in your legs, and it goes into your lungs, and again, poor oxygenation, you end up dying.
But it sounds like she had a
Just a
brain
headache.
herniation, like she had a headache.
yeah,
So
but-
and then just became unresponsive. That sounds like
Yeah, but you can have a headache from anything. You can have a headache from acute blood loss.
right, but they're saying the
But did you
reports are
say
saying
she
that
had
her
bleeding internal?
no, they said her torso had bleeding, probably from where they took the fat.
Mm-hmm.
But the reports are that her brain was swelling. So like somewhat when brain swells, it can no longer fit in the skull, so it starts herniating down.
Right.
But could that be
the
like a
brainstem.
fluid imbalance, like you all like can
Yeah, could that happen?
that their
could
sodium
cause-
level
yeah.
got off, and then they
What could cause
Let's say there was herniation.
too much
What?
fluid from the lipo?
Yes. Could
Isn't that something where you put too much fluid in and then their brain swell or something?
that would be highly unlikely.
Okay.
The things that come immediately to my mind, PE, fat embolism, If assuming that she's completely healthy,
Right.
and then bleeding. I mean, anytime you have surgery, you have a risk for bleeding. If you have a BBL, you have to suction out fat. So where do you take the fat from? Your abdomen, flanks, your back. And if they have someone loses a substantial amount of blood, I mean, yeah, they can die.
People don't talk about the risk of BBL. Number one, it's one of the most popular operations
Right.
that we do now. But
Give us some stats.
Yeah,
like
give us
for
some
every
statistics.
100,000 BBLs,
'cause
I don't know if
read-
there's that many being done, but
No,
His
so-
stats are good.
Because I read a major, the Plastic Surgery Society actually announced about the risk of the
Right.
fat embolism. Just talk about that a little.
Yeah, so when this procedure became popularized, I would say maybe it was like 10 years ago. When it became popularized, they were actually putting the fat under the muscle. And the reason you put it under the muscle is because you get more projection that way. And so what was happening, they started to have these deaths. And then after investigating them, they realized that, hey, putting the fat under the muscle, that's unsafe. The Plastic Surgery Society came out with a recommendation that the fat should only be placed subcutaneously. And then in some places like Florida, where, it's high volume, so they charge really low prices, but they have
do
to
a lot of them.
Yeah. And so you have plastic surgeons, you have cosmetic surgeons, you have people who maybe aren't even surgeons doing this procedure, and they're just putting the fat in, and of course, you'll have a higher complication rate. And so the mortality was so high in Florida that the Board of Health stepped in, and now they've come up with all these guidelines, and I believe they can only do like 4 a day. So that's really not addressing a problem. Now you can also use the ultrasound. You can do an ultrasound guided BBL where you use an ultrasound to make sure that the cannula is in the subcutaneous space. So the safest way to do the surgery is to inject the fat subcutaneously.
okay.
Thank you for that.
Thank you for that. In any event, my attending used to tell me if you don't have complications, unfortunately, you're not operating enough. And that's just medicine. I mean, surgery, you could do 1,000 cases. At some point, you're bound to have a complication. That's just medicine. That's just the nature of the beast. We wish everything could turn out perfect, but that's not always the case. So moving on, last case, there was a patient, she was in labor, baby got stuck, ultimately ending with the baby's head being cut off or beheaded. And the story goes that the hospital tried to cover it up. Now, is that real or fake? Does that
Let's
sound
go.
real or fake?
I think it's messy, but I think it really happened. It happened. Yes, it's real.
Okay.
I think it happened, so I'm gonna say it's real. I'm looking for my tragic poster, and I don't have it. It's tragic for all parties involved.
As physicians, the way you all are saying it, I think you all are looking at it as a, this is something that can happen, that, in childbirth, we all know that childbirth can be traumatic. And if you look at the history of childbirth, and women die during childbirth at a much higher rate and historically in children also. But I think the public looked at it as there was a live baby whose life was it while the baby was alive and their head was cut off, in this barbaric way. And so in that way, I'm saying that that's fake.
And I fully agree with
That this was not a situation where there was an alive baby who was in there crying and trying to get out, and that part of being alive as a baby was actively decapitated as an alive baby. And so that's why I think that this story was very messy, the way the media portrayed this story, because they wanted to sensationalize it. They wanted clicks, and that's a very click-worthy story. Ooh, because we as physicians, we knew, okay, well, sounds so. That's unfortunate, but the public looked at it as there was an assault and there was a murder, and that is not what happened. And that's not, we try to save lives, not end lives. And so this physician was unfortunately just ridiculed, and so many unfortunate things were said against her. And I do think that there were lots of situations that happened that if you look back on, I'm sure she was like, man, I should have done this, man, I should have done that. But in no shape or way or form was intentional harm meant to come to that baby or mother.
I will say that the way it's presented in the media, we're not getting the 100% truth. And I want the audience to understand that when it comes to these cases, doctors cannot go out in public and give the details of what really happened. They'd be violating the law if they did that. The lawyers and the patients, they can present it a certain way. So I think the way it's presented is not 100% accurate. So I'm going to say the presentation is fake. The case is very real. Now, me and Jocelyn, we're OB-GYNs. We can tell you when we get board certified, we have to go to Texas, sit in a room, and we have other doctors asking us case scenarios. And one of them is based on what's called a shoulder dystocia. Shoulder dystocia basically means a difficult delivery where the head gets delivered, but the baby doesn't fit, the shoulder is not fitting out, and this can happen. And what they do is they want to challenge us and press us, and they're like, okay, you have a shoulder dystocia. What do you do? Doctor, what do you do? Shoulder dystocia. What do you do? Then you say, well, one, I try to rotate the
Didn't
shoulder.
work.
Didn't work. It didn't work. Okay.
Didn't work.
I'm gonna then fracture the clavicle.
Still didn't work.
Well, then I'm gonna rotate again and see if it works.
Sorry.
Didn't work.
Everyone's crying.
Then I'm gonna fracture the other clavicle.
So why
Hold on,
don't you
hold
just
on.
do a C-section?
But the head is
head
already
is
out.
already out.
The head is already out.
Okay, so you're
Whoa.
there and you're taking too
Nick,
long.
when the grown
Wait,
folks
hold
is
on, hold on.
talking.
Oh, snap. Now we're talking.
Oh,
Let
so
us-
that's what we doing?
So when we,
Yes.
So, you know, in some
When the
places,
surgeons are talking, when the surgeons are
may
talking.
not even be considered surgery.
Oh, wait, hold on.
So
How grown
Messy.
can we be?
Messy.
That's
I
me.
need some water.
Messy.
So hold on. So let me finish.
Okay,
Right?
finish.
Let me finish, and then you can
Okay, yeah.
interject after. All right? Can we
Let's
do
do-
that?
yeah, let's
Thank
do
you.
it.
So the whole point is that you go through it. This is the head has delivered.
Right.
The head is
It's
right
all,
there.
This is all hypothetical, yeah.
No, it really
no,
be
it
happening.
can happen.
Okay.
Right?
But
It's not
okay, so you
hypothetical.
can't. So the head is out.
The
Her
head is
leg
out.
is. How are you gonna do a C-section?
Right.
How you gonna get the
No,
baby?
I'm
in?
listening. I'm
Okay,
listening.
okay.
So
Nick, I want to remind you also that your responsibility as an OB-GYN is not only towards the baby, but
To the
also
mother.
to the mother.
Right.
She's first responsibility.
So let's finish. The head is out. Again, this is a board scenario, a board question that we all have got.
Mm-hmm.
Okay? You go through your maneuvers. You turn the shoulder, you fracture a clavicle, you
Break
try and
the
deliver the
humerus.
posterior arm, you fracture the
Cut
other.
the episiotomy.
Yeah, you do
get some
all
more
these
room.
you do all these
Right.
maneuvers, right?
It don't work.
And it doesn't work, right? And
And
the
the
baby
head
is
is
still
still
stuck, right?
Okay.
They will take you down this rabbit hole. And then afterwards, if you're in such a dire situation, right? They may say, what about a Zavanelli maneuver? Zavanelli means basically you try and shove the baby back up in the vagina and get it up there and then go to the OR to
Right.
deliver it abdominally. But if you're having to do that, you're having a bad day as an OB-GYN.
Right.
You're trying to get the baby out as soon as possible. You gotta think about time. To convert to a C-section, that means you have to put the bed together, go to the room, get her on the room, get her. So if you can get this baby out in 10 seconds or 15 seconds versus going to the operating room, it's gonna be about at least
Right.
120 seconds to 5 minutes. You're gonna do as many maneuvers as you can right here.
Right, but
And-
we're not talking about, this doesn't sound like it took 10 seconds.
No, this is
Yeah.
you're
doing all these
you're
maneuvers,
doing all these
trying
maneuvers
to get it
over
out.
time.
Yeah, you're
So-
like, try this, try that, and then the time gets going, and so most likely it kept going, and if you still can't do it, then you're like, my last ditch effort is to try to shove this baby back in and try to go back to the seat to the operating room.
And then the way the board question will go is, all right, then I will take her to the operating room with the head dangling out the vagina, and I'm going to try and do a C-section, and I'll try and see if I can push the
it
baby,
back up or
push the
yank
baby
it out,
out,
try to
or maybe
yank
somebody
it back.
push and
While I'm
you
trying
know
to
push the
pull it
baby
back.
back up while I pull up, right?
Okay.
That is a very difficult procedure.
rough.
It's rough. There's going to be a lot of blood loss if you're having to do that. Now,
Have you ever done that?
never.
No, not
So,
where's the
thank
word?
God.
Where's the where?
Right? So I'm just saying that what'll end up happening is the board examiner will then say, you've done all this, the head is there. And what you have to ultimately say, and what they want you to say is,
baby's
you have to tell the
deceased.
patient this is a very bad outcome. Unfortunately, the baby's just stuck. I can't, I'm gonna have to behead the baby. And you do it with electrocautery so you can at least get the head out one way and pull the baby out the other way.
Because the mother is bleeding at
But
this
that's
point.
never, I mean, have you ever had to do
No.
this?
We've never had to
But
do
you-
it, but
but
it's happened.
I
That's the whole
understand
point.
that.
If you've got a mother whose uterus is splayed open, 50% of your blood goes to your uterus when you're pregnant.
Right.
So your
don't have
uterus
much
is
time.
splayed open. They're bleeding. You may, and you know this baby is deceased. At this point, there's been 10 minutes.
Right.
You know the baby is already deceased. You're confirmed that the baby is deceased, and in order to save the mother's life, you may have to compromise the anatomy of the baby
And that's
in
the-
order to save the mother's life.
And
As
that's the point
OB-GYNs,
that-
we have to make horrible, sometimes awful decisions in order to save people's lives. And it is a tough pill to swallow. And we do the things that nobody sometimes wants to see.
Right.
We're doing things behind, and we try our best to make it look pretty as best as we can. And it's not for public consumption what we do. That's why, you may didn't want to go into OB-GYN because it's a great field. It's a great
I
field.
love what you said about it's not for public consumption. How do you explain the pathologist posting pictures of the baby on social media without the parents' consent? Because that's where
horrible.
yeah,
Is that what
horrible.
happened?
That's what exactly what
Well,
happened.
okay, so we're
I didn't know that.
diverting.
So
Let's
then-
focus. Let's focus.
No, that's,
Well,
that's,
I'm not aware
that's
of it.
what led.
that's the
I did
messy
my
part.
research, sir. That's what
That's what
led to the
happened.
messiness.
That's why we're
Okay.
having this discussion right
Okay,
now.
so here.
So it may be, it's probably real then.
No, the case is real, but what I'm saying is, how did this take place? So one, okay, this is one scenario. Patient is laboring, and perhaps there were signs that this baby was too big, and the doctor didn't act early enough, right? And she delayed the C-section. Let's say the patient was complete for 5 hours and then finally got the head out. But 5 hours is a bit much. I would have
5 hours in labor?
5 hours being
Completely
complete and
dilated.
pushing,
Okay.
and still the baby's not out. That's too much. I would have done a C-section like at the 3 hour mark, right?
What if
That's
this
the-
was her first delivery?
It
and
doesn't
she
matter.
had a
3
natural
hours for
birth?
her.
Right. And
Right.
we don't know if this happened.
And
We're just
speculating.
us just saying
I'm
person,
giving you a
anybody.
scenario where the doctor was negligent.
We're
I'm not
giving you a
saying.
lecture, Nick, on how to do surgery in the cavity, not just under the skin.
Woo!
So hold
But
on.
you know plastic surgeons are a surgeon.
Yes, we went over this before.
Subcutaneous
So,
surgery.
Okay.
well, let's. This is one scenario. The doctors were negligent in that they went outside the standard of care. Right. That is what medical malpractice is. That's what negligence is. Us doctors, we're held to a standard of care. So, if a patient is complete and it's her first baby and she's pushing for 3 hours, well, the standard of care is at 3 hours, you call that arrest of descent, arrest of labor, whatever have you. The recommendations would be a C-section. So let's say that doctor pushed it to 6 hours and then the head finally came out and then you had this outcome. That's medical malpractice, that's negligent, right? That's one scenario. The other scenario is that perhaps the patient was offered a C-section but didn't want a C-section. I was like, I'm gonna keep pushing. We're doctors, you have patient autonomy, we can't control what you do. So in this scenario, perhaps the patient declined the C-section, pushed the limit, and then we ended up here.
Right.
Okay, now, as far as the cover-up goes, again, that's the part that doesn't sound right. I
sounds
just
very
don't see
safe.
how you could, the story goes that the head and the body were pieced back together and presented to mom. And I don't even know, like, if the baby was still alive while she was pushing or not. There's so much details.
I mean, you've kind of alluded to, like, this is, you may not ever experience this.
I
in
don't
your-
ever wanna
in your-
experience
in your
this.
career. And so just like you've never seen it, that was probably, maybe that was the first time a lot of the staff had seen it.
Absolutely.
And so you have lots of people involved. So it's probably easy for things like that to get out of the hospital.
It's horrible.
Absolutely, absolutely.
And another possibility, another scenario is, let's say Jocelyn's the patient. I'm like, Jocelyn, unfortunately this baby is stuck. Baby is not gonna make it. I have to take it to the OR, try and do this, and maybe have to behead the baby. And the patient's going through so much, it's so much at one time, doesn't hear it, and then you behead it, and maybe you just don't want to traumatize the patient by having them see the baby without the head. That could also be it too. It doesn't sound like it was malicious.
Right.
Okay, that's the whole point. That's what gets lost because that is we can relate to the OB-GYN. I'm pretty sure she feels horrible, wishes this didn't happen, but bad outcomes can happen. So I don't think it was malicious. I think the way it's being presented is fake. But again, this is medicine. Bad outcomes can happen. Well, that was an episode with us, Messy Medicine. We're going to keep on combating fake news, try to clarify some things with evidence-based knowledge in medicine. That's it. Until next time. There we go.